Something to think about now that we are in the middle of winter is how the weather can impact our health, our heart health to be specific. Hartford Healthcare's Dr. Anya Wagner joining us this morning with the Heart and Vascular Institute at St. Vincent's Medical Center to explain more. Thank you so much for your time this morning.
Thank you for having me.
So is it true that winter can actually increase the risk of having a heart attack?
Yeah, that is actually true. Indeed, studies have shown that Americans are 30% more likely to suffer from a heart attack during the cold winter months.
Why is that?
Yeah, and that is because in the winter, the vessels, particularly the arteries, they constrict, and that increases your blood pressure, but also really diminishes the blood supply to your heart muscle.
Wow.
And when it's cold, the heart has to work harder to keep a healthy temperature.
Yeah. Who's most at risk for this?
So that's a good question. It's mostly really patients with an underlying heart disease, particularly patients with narrowing of the coronary arteries. That's called coronary artery disease. So these patients are really at a higher risk.
Is there something that we could all be doing to better protect ourselves and keep ourselves healthy?
Yeah. I mean, we definitely should continue a heart-healthy lifestyle in the winter. So that's a heart-healthy diet, that's to maintain a heart-healthy weight, and regular exercise. But please don't do strenuous exercise in the cold.
Yeah, like shoveling, that can actually lead to a heart attack. Absolutely.
Shoveling is really the perfect storm because it's strenuous exercise and the heart really has the demand of working harder, having a higher blood pressure, and really it's the perfect storm for a heart attack.
I know that there are warning signs. Can you just remind us and all of our viewers of those warning signs that we should be on the lookout for?
Sure. So the most common signs are basically for heart attacks are chest pressure or chest pain. However, women particularly tend to present with really more vague symptoms, like shortness of breath, nausea, vomiting, or just fatigue, or just in general, just not feeling well.
All right, so look out for those signs. And, you know, we're still dealing with this pandemic and the COVID surge. People could be a little hesitant about calling 911 or maybe going to the emergency department. So what is your message to the people who are a little afraid to seek help when they probably need it?
So that is a question I hear very often from my patients. But in fact, emergency rooms and hospitals have implemented really strict protocols to keep our patients safe. But what could be potentially harmful is if you have a medical emergency like a heart attack or a stroke and you delay treatment. So our emergency rooms are safe, but what certainly isn't safe if you delay treatment for an emergency.
Yeah, all of this was very important to know, and we appreciate your time, Dr. Wagner.
Thank you so much.